All right, welcome to today's webinar, Advancing FFPSA Requirements, Tools for Selection and Sustainable Implementation of Evidence-Supported Programs, presented by the Child and Family Evidence-Based Practice Consortium. This webinar is hosted by the California Evidence-Based Clearinghouse for Child Welfare, commonly referred to as the CEBC. My name is Jennifer Rolls-Roots, and I'm the director of the CEBC, as well as a member of this consortium. Before I introduce our presenters, I'd like to review a few webinar logistics. Trip, if you can advance one slide. Thank you. So you're probably familiar with this, given the number of Zoom meetings that have gone on in the last few months, but I'd like to just remind you the audio controls are in the bottom left-hand side of the Zoom screen. We've muted attendees, but you can still test your audio connection and select what speakers or headphone you want to use. If you have questions for the presenter or for the CEBC during the webinar, you can submit them using the QA section at the bottom of the screen. We'll save your presenter questions for the questions portion at the end of the presentation. Please note the webinar is being recorded and will be archived on the CEBC website for anyone to view. And within the next few days, along with the PowerPoint slides and relevant handouts, you'll receive an email when the recording is posted. And then lastly, at the end of the webinar, you'll be directed to take a brief feedback survey so that the CEBC can improve our webinars and make them as useful and relevant as possible. You'll receive an email with a link to the survey shortly after the conclusion of the webinar, and there'll be an opportunity to download a certificate of attendance. The CEBC is funded by the California Department of Social Services, Office of Child Abuse Prevention, and operated by the Chadwick Center for Children and Families at Rady Children's Hospital in San Diego. Now I'd like to introduce our presenters from the Child and Family Evidence-Based Practice Consortium. Rosalind Bertram, PhD, directs the Child and Family Evidence-Based Practice Consortium in its many projects and publications. With other consortium participants, Dr. Bertram studied the extent to which evidence-based practice is taught in North American MSW curricula and produced a series of national webinars addressing these findings. With Sue Kern, she served as co-editor of a 2018 special issue of the Journal of Social Work Education, focused on how to integrate evidence-based practice and implementation science into the academic curricula. Dr. Bertram is a professor of social work at the University of Missouri, Kansas City, and editor-in-chief of a new Springer Press journal, Global Implementation Research and Applications. Jackie Brown is an international implementation consultant and executive director of Families Foundation and the exiting co-director for the Child and Family Evidence-Based Practice Consortium. Jackie serves as co-editor of a 2020 special issue of the Journal of Family Social Work that features presentations from the 32nd Annual Research and Policy Conference for Child, Adolescent, and Young Adult Behavioral Health. As an implementation practitioner, Jackie is involved in the implementation of FFPSA in Europe, Australia, and Sub-Saharan Africa, as well as implementation of best practices in the healthcare sector across Canada and the education and community-based services sector in Ontario. Dan Edwards, PhD, is Senior Director with Evidence-Based Associates, an award-winning organization that provides technical assistance, implementation, and project management support, focusing on the high-quality implementation of evidence-based programs for at-risk children and families. Dr. Edwards leads the team's work with multiple child-serving agencies across several states that have adopted evidence-based programs and are pursuing rigorous implementation and high program fidelity. Prior to coming to EBA, Dr. Edwards was clinical professor at the Medical University of South Carolina and vice president at MST Services. He also served on the board of the Association for the Advancement of Evidence-Based Programs. George Tripp Akey, PhD, is a licensed psychologist at the Center for Child and Family Health and director of training and implementation at the National Center for Child Traumatic Stress at Duke University Medical Center. Dr. Akey and the NCCTS training and implementation team have extensive experience in providing support and consultation to the National Child Traumatic Stress Network on use of learning collaborative and breakthrough series collaborative methodology. He is an associate professor in the Department of Psychiatry and Behavioral Sciences at Duke University Medical Center and an adjunct assistant professor in the Department of Psychiatry in the UNC Chapel Hill School of Medicine. His clinical and research interests are in the area of trauma, interpersonal violence, and trauma-informed child welfare practice and implementation science. So now I'll turn the webinar over to Rosalind. Thank you.
Let me unmute myself and you can go ahead and advance to the next slide, Trip. Welcome everyone. We're really excited about doing this presentation. We've been developing these tools over the last year or so when it came to our attention through our individual work and then in discussing it in the consortium, that it was possible that, as wonderful as the Family First Prevention Services Act seemed to be, there were some hidden potholes that we wanted to help programs and state systems avoid. So the tools that we're going to be presenting to you today and 2 weeks from today on October 5th will hopefully, through these webinars, by the end of them, you'll be able to identify how useful this tool could be in selecting a program for that sort of funding. And you'll be able to identify how you can use us as the Child Family Evidence-Based Practice Consortium, as well as other resources in the process of selecting and installing and implementing these practices. And you should be able to identify next steps for your planning processes. Next slide, please. This is drawn directly from the EBP Consortium website, which is basically ebpconsortium.com. There will be a slide that offers you this address and our Gmail address at the end of the webinar. We've been engaged as a consortium for, when did we start? 2004, actually. Predates my involvement, in fact, all of our involvement, I believe. This is an evolving group. As issues arise in the field, as concerns come to the forefront, we bring together people who are active in grappling with them and develop various projects, all of which you'll be able to find on the website. Next slide, please. This is a brief look, and again, it'll be available later on our website, and I think CABC is also will be sending you these slides. But you get a sense of how we have participants currently in our leadership group from every part of the country. Elizabeth Kanata is very active in Connecticut and in New York. Dan is active nationally and in the Mid-Atlantic and South States. Bob Franks from Judge Baker Children's Center, involved in the Northeast with Harvard and Yale, et cetera, et cetera. Sue Kearns is, I don't know if she's here or not, but Sue's a marvelous colleague. I've done a lot of work with her, very, very engaged around evidence-based practice as the director for Center for Effective Interventions at the University of Denver, et cetera, et cetera. There's a lot of expertise here that can be accessed. Next slide, please. Here's some of the emeritus participants. David Bernstein, Patrick Cannery were the first two who brought together colleagues, both from practice and implementation and research focus in 2004 to form the consortium. Bianca Albers still interfaces with us from time to time. She's since moved on from Europe to Australia. So you get a sense of, you know, we've been around the block a couple times here. Next slide, please. Here's some recent research and dissemination that we've done. We've been producing special issues of some key journals, often based on presentations made in a track that we offer in the research and policy for child adolescent, research and policy conference, I'm sorry, for child, adolescent, and young adult behavioral health, which occurs in Tampa, Florida, although it's been temporarily suspended due to the pandemic. But we draw presentations from around the country, and you can find them in the Families in Society, Journal of Contemporary Social Services from the 29th conference, and more recently, the 2020 Journal of Family Social Work from the 32nd conference. Next slide, please. So we just want to encourage you to explore and contribute. This is not a closed group. We're very open to engaging you. We will, in fact, be hoping to engage some of you in the use of these tools, and we'll talk about that more at the end of this webinar. Okay, I think next one up is Dan. Next slide, please. Nope, it's a poll question. Sorry. Go ahead, go to the poll question. Jen, you want me to do this?
Okay, let me.
Better if you did, I think. Yeah, because you're going to see this.
Yep, let me go ahead and launch the poll question. So the first is about who you are employed or associated with. So let me go ahead and launch that. Go ahead and vote on that. I see numbers coming in. We'll give it a few seconds on that. So the options are public child welfare, child protection agency, some other public agency, a service provider, and then other. So it looks like our votes are starting to slow down. Let me give it a sec. Okay, I'm going to go ahead and end the polling and let me show the results. So as you can see, we've got about 27% public child welfare, child protection agency, 12% some other agency, 24% service provider, and 36% other. For those who said other, if you want to enter some information into the chat box, that's great. That gives us some great information. So thank you.
Thank you. Next slide. Is the second poll question correct? Yes.
Yeah. So let's launch that one. So this is about where you are in the selection of EBPs for implementation in your system or community. So the options are, we haven't started the conversation yet. We've had a few conversations, but are really still exploring. We've started to identify and propose specific programs, or we've actually already decided which EBPs we're going to implement. All right, so I see.
This is really interesting, actually.
Yeah, there's lots of results coming in. Let me give that one a few more seconds. Those are a little longer to read and figure out which stage you're in. Okay, it looks like it's starting to slow down. So I'll go ahead and end the polling. And let me share the results. So the largest response was actually 46% saying they've already started to identify or propose specific programs, followed by about 24% who've already decided what they're going to implement. Oh, sorry, 26%, or almost tied. We've had a few conversations, but are still exploring, and still a few people who actually haven't started the conversation at all yet. All righty, thank you. I will stop sharing those results, and then we will, Trip, you can go ahead and advance to the next slide.
All right, I think this is me. Good afternoon from the East Coast, everybody. Good morning, or yeah, good morning for the rest of you. I think when Rosalind said we've been around the block a few times, she meant that in the very best possible way. So we do have a wealth of experience among the members of the consortium, and it's been great. I've been a more recent addition to the team. It's been great to get to know folks and to be working on these tools. Jennifer, I don't know about other people, but the poll results are still showing up on my screen. Is that something that I need to close, or do you close it at yours?
I think you can click it off yourself.
Oh, you're right, I did. Okay, cool, thanks. Many of you are familiar with FFPSA. I do want to say that the tools that we're going to be introducing are not specific to FFPSA. I know we have at least one Canadian on the phone who isn't going to be impacted directly by FFPSA. So the tool was originally designed as for broad application inside of and outside of the United States, whether you're impacted by FFPSA or not. But as a way to kind of set the foundation, we wanted to talk a little bit about FFPSA and set the stage for some common language around the Federal Act and some of the terminology they use. So most of you have heard of it. It is the Family, singular, Family First Prevention Services Act, or FFPSA. It was passed as a federal law in February of 2018. And it's an amazing federal law. The scope and scale of it is remarkable. So it was actually aimed at changing the way in which states approach their responsibility to protecting the welfare of children. It supports evidence-based and trauma-informed prevention programs through fiscal incentives, both, I would say, both carrots and sticks. And we're going to skip a lot of the details and just focus on one part of the Act today, which is the prevention and early intervention community-based programs. The Children's Bureau has needed a way to define and rate evidence-based programs. What is an EBP? I've been around long enough to know that over the 25 years or so of my career that there's been very little agreement on what constitutes an EBP. So this was the federal attempt to try to define that and begin to create some common language. The Children's Bureau created the clearinghouse for the Title IV prevention services. And there's a website there, link on the slide, preventionservices.appsites.com. In the clearinghouse, evidence-based services must meet one of 3 levels of evidence. As you know, the lowest level is a promising practice, which is a practice that shows at least one effect or contrast with a moderate level of research rigor, as rated by the clearinghouse. The second level is supported, which is very similar, but also shows sustained effects on at least one outcome measure for 6 months or more. And then the one that we'll be spending most of our time focusing on, I think, as a group, is the well-supported category, which is at least 2 contrasts or favorable effects in a moderate or highly rated study in terms of the research design and the way it was executed. And the outcomes must last for 12 months or more. So it's a very high level standard to reach a well-supported practice. The kicker is that 50% of state funding or state programming must include or must be spent on well-supported programs. Now that was originally a part of the law that was supposed to go into effect right away, but it has been phased in now over the next few years. But it is still a target for states to have 50% of their funding spent on well-supported programs. So beginning last year, actually on October 1st, states could receive funding to start evidence-based programs. Once they identified candidates for foster care, and those are state-by-state definitions. And states are required to include their definition of candidates and the programs they plan to implement as part of a state prevention plan that's submitted to the Children's Bureau. I believe we're at 8 now, or maybe it's grown a few, but 8 states so far have had their plans already approved by the Children's Bureau and have moved on to implementation. All right, Trip, can we go to the next slide? Ideally, this is a cart and horse sort of thing, but why would we want to adopt an evidence-based program? Hopefully because I think the cart is, I'm sorry, the lead is to improve client outcomes and to fill gaps in services at the community level, and not just simply to access the funding. So part of our conversation today is really trying to understand where are the needs and the gaps in the community. All right, next slide. As some of you are still exploring and some are in the early stages, depending on your familiarity with evidence-based programs and sites that sought to define and categorize evidence-based programs in the past, it's a bit of a evidence-based practices universe out there. And some of you may be feeling a bit small, like me, when you think about how big that universe is. But we want to talk today about an informed exploration. Next slide, please. There's been 3 primary websites, especially for children, youth, and young adults, that have led the conversation over the years. Well, 2 actually. The Blueprints program, which had historically a juvenile justice focus. It used to be called the Study for the Prevention and Study of Violence. And they broadened recently, but still have that sort of juvenile justice delinquency lens. historically. And then the California Clearinghouse, of course, where Jennifer and her colleagues work, is the preeminent site for the child welfare programs, and have spent years building out a very remarkable database of literally hundreds of programs and sorting them by not only their level of evidence, but their applicability to child welfare. And then the new one is the perhaps the most important one in terms of funding anyway. So the Title IV Prevention Services Clearinghouse, which we've just touched on, will be guiding the Title IV spending. There's 3 others listed there. Won't talk too much about OJJDP or child trends, but Trip, when you come on, you may want to say a couple words about the Traumatic Stress Network. Next slide, please. So the tools that we're going to be talking about are really for the purposes of selecting and then really helping prepare for implementation. Just a quick note of caution. It is, I think it's really important to say right at the outset, again, those of us that have been around a while, we have seen evidence-based programs fail. They can fail. They do fail. And I'm talking about implementation failures. States or counties that have adopted programs, and then we look back 5 years later and they're not there anymore. So, you know, this is a place where it takes a tremendous amount of effort to plan and to implement. And hopefully these tools will help you to avoid what we see as some of the common errors. Things like a provider agency may say, well, the easiest thing for us to do would be to add on to an existing program or to adapt an existing program. We already have the staff, they're trained in models that are similar, and so we'll just look to expand that. I would caution carefully about doing that too quickly and without really doing the due diligence and considering what's involved with an EBP. Sometimes we pick what's easiest or what's most popular. It's sort of entering the voting booth and looking for the names you recognize. But we really want to encourage folks to stay away from that. Our friends at the National Implementation Research Network in this Select, Train, and Deliver idea talk about things like train and hope or spray and pray, things that we know don't work. And so it does take a lot of work, both on the sides of the implementing organizations, the funders, as well as the purveyor programs to do this the right way. I think that's it for me. I am going to pass it at this point on to the next slide and to Trip.
Great, thank you so much, Dan. And thanks to all of you for joining us today in this first of 2 conversations around selection and implementation in this particular tool. So some of the things that I'm going to cover are really kind of teeing up a little bit more around what the tool was meant to kind of address. As Dan mentioned, many of us had a conversation around seeing folks select practices based on what was maybe easier to bring on board or that was most familiar, and then not necessarily having the best experience to sustain those practices or not meeting the needs that they had. And I think that, you know, our hope is that maybe some of this information and this tool can help folks avoid some of those experiences. And the data that was shared earlier around the people on the call and where they are in their process was super helpful, like Rosalind was saying, especially for those that are in that early kind of stage of really thinking about what's available, as well as those that are kind of narrowing down their list and trying to think about out of those that are available to us and that we're considering how do we make this kind of decision. So this is a kind of a broad kind of view of some of the fact sheets that we're developing and some of the things that we'll walk through, some today and some next week, as we have a tip sheet that we would like to kind of walk through and helping folks really think about this goodness of fit. Some of the things that we'll just kind of reiterate over time as we're thinking about this particular tool are making sure that folks are defining their target population very well, thinking about you know, who is it that we want for this intervention that we're thinking about onboarding to impact, and how does that map on to our target population needs? Starting to build from strengths and really addressing service gaps. So it will take states and agencies quite a lot of data to determine some of the answers to these questions as they're kind of considering their options. Also, thinking about how will they look at improvement? What will be their measure of if something's working or if they're implementing it or not? Also looking for opportunities to avoid duplication. I can't tell you the number of times that I've heard of other states and other parts of the country say, well, we have a practice that addresses this age group, and they actually address many of the same targets, and we didn't realize that this other practice was also being implemented in our state and addressing similar types of things. So we want to avoid service duplication, and also think about ways of supporting buy-in from both community stakeholders and partner agencies in this particular work. And the work of the National Child Traumatic Stress Network, which I'm a part of, there's a lot of groups that are already focusing in on development of white papers and development of other kind of considerations about how to make child welfare and this particular work more trauma informed. So there's a lot of resources there as well, but I think that this particular tool is really focused on the implementation pieces. Also thinking about organizational capacity and fit. So who is it that you have to have trained? How will they, what will the training and coaching look like? Knowing that some practices have a whole lot of data, but if they're not implemented well, it won't make the same impact as what the evidence kind of shows. Thinking about who's going to be collecting data, how we monitor how it's being brought on, and then what are the cost policies and procedures to be considered. And again, buy-in from staff and partner agencies, as those will be the ones that are on the front lines of the work. And so we're going to examine these a little bit more closely. And as Dan mentioned earlier, just as a reminder, we're really starting the conversation around FFPSA and how this tool could be applicable there, but also just want to make sure folks know that this kind of thinking around selection and implementation is something that can be used for lots of different program selection, and so it's not just limited to FFPSA. So I'm going to turn things over, I think, to Jackie now.
Good afternoon, everyone, or good morning if you're still in a morning time zone. As Rosalind suggested, I'm from Canada. I'm not part of a service system that is going to be adopting FFPSA. And so the tool itself that we're presenting really does apply to a number of different things, but will be very helpful as you're considering what you're doing for FFPSA. Implementation science has taught us a great deal over the last 15 years, and it's particularly focused on some of the things that we need to think about when we are deciding what we want to implement, for whom, how we're going to do it, and what capacity we have to do it. So let's think about some of those things, and this tip sheet has really set up a number of questions for you to consider whilst you're thinking about things. And I'm going to focus on the candidacy group. So Trip to the next slide, please. The candidacy group, the people who you are going to serve, are really critical in choosing which program. There are a number of other elements that are critical too, because how you provide service, who is providing the service, who your workforce is, what your culture, all of those things are really important. And how the people you're going to serve will receive this service is really important. So next slide, please, Trip. So what are the things that you should start to think about? And the tip sheet has these questions on them for you to think about. What are you trying to address? What is it that you want the families to overcome? What is it that is causing concern in terms of the experience that has led them to needing service? What is it, by serving them, what is it that you want to achieve? What is it the families want to achieve? What is it the community wants to achieve? we're very focused often by our funders on how many people we see. Well, how many people we see doesn't tell us whether we've made any change. We can see 1,000 people, and if we only change the trajectory for 2 of them, that's not great. So we really need to think about, at each of these levels, what is it we want to achieve? And that's what the outcome is. Implementation science has provided for us lists of influencing factors that we may want to consider in how those outcomes can be achieved. So in each of your contexts, in each of the places you work, in each of your states, your agencies, in each of the roles that you have, there will be different factors that influence the capacity to achieve those outcomes. Really important to start thinking about those factors early, because it might actually inform the choice of a different program. As Tripp said, we don't want to duplicate. We don't want to be doing things that are already being done. We don't want to decide on something that isn't addressing a specific need. So we need to really look at what are the needs, what are the current services, and how are we going to address those needs by filling gaps to service, or by complementing services that already exist. And then once we've got a sense of who we want to serve, what the influencing factors are, what are those outcomes that we want to achieve, what's our capacity to do that, then we can start looking at, okay, what are the offerings that indicate from the evidence that they address the needs, they will address the risk factors, and they will achieve those outcomes. Then we start to look at what are those programs and have to choose between them. Next slide, please. And you have to use data to do that. So you need to think about what current information do you have about the candidacy group, about who's serving that candidacy group, what's going to address those risk factors and the protective factors, and strengthen the factors that are protective and mitigate the risk factors, and what are the variations of programs that are there, because you don't want to do anything that will simply duplicate or not fill a gap. You want to do something that will complement what's already there, build on strengths, and address the gaps that those data are telling you are existing. You need to look at who your team is. And do you have a capacity there that you haven't fully utilized yet? Because very often we do. And are there things that you can build on? Are there strengths in your capacity that will enable you to do more with what you've got? So those are some of the other questions you want to be exploring. What is your current capacity? If it's not quite enough, can you expand that capacity? Just because you don't have the capacity now doesn't mean that you can't look to expanding that capacity. And the next slide, please, Tripp. So once you've considered who it is you want to serve, who you've got to serve them, what capacity you have to serve them, what are the practices out there, you need to really engage and look at the priorities in your community and for your organization. So there are lots of variables that you need to consider. The tip sheet that we've suggested is a very simple awareness prompting consideration tip sheet. There are a number of implementation science tools. Why we've developed this tip sheet is many of those tools can be quite cumbersome to use, may not be as easily tailored to specifically what you want to do. So the purpose of generating these questions and asking you to consider these variables is so that you start to make the information fit, using your own information and tailoring things to the specific needs of your candidacy group, capacity, community. So from this, I think I'm going to turn it over to Dan.
Yes. So it really is that I think a lot of what we've been talking about has been this issue of trying to find the right fit, candidacy, level of evidence, age group. I didn't mention earlier when we were talking about FFPSA, there's also the three, for lack of a better word, buckets or target issues of mental health, substance abuse, and in-home parenting programs. So there's a bit of a schematic to this process of trying to figure out which age group, the level of rigor and the targets. But finding that fit is oh so critical. I know that the 8 or so states that have applied and gone through the approval process have tried to demonstrate that the programs that have been identified and selected or proposed at least have come up as a result of doing a scan of the environment and of the data for the populations that are being served. So if we could go to the next slide, Trip. There's a set of questions here. And again, these are just sort of introductory, quick, so you get a feel for what is in the measure and sort of what questions are being asked. The first set of questions might be most appropriate to the agencies that are overseeing the implementation. As we draw up our plan, what is the evidence of the programs that we are reviewing of their impact? What is their level of evidence? And what are the outcome measures that have proven those 6 and 12 month sustained effects that we talked about? What's the time frame that's needed to achieve outcomes from the time of program selection to training to ramp up to fidelity? And are the programs culturally appropriate? And what's the evidence for that? Are we impressed by the evidence? Are we committed to the journey? Are we convinced about the cultural appropriateness of these programs? Are 3 important questions, I think, for state agencies. The next set of questions might most directly apply to providers. What do we have the capacity to deliver? Staff in terms of their qualifications or experience. The costs for training and consultation, how long does that last? This is not a quick, watch one, do one, teach one sort of model. These usually take 6, 12, 18 months for full implementation. What does supervision and coaching look like? How frequent is it? What forms do we need to fill out, or what online resources are available to support continuous quality improvement? And then what are the overall costs? Next slide, Trip. I think the third set of questions, or a set of questions, has to do with identifying potential partners, which is probably important for both groups to look at, state agencies and community level providers. So who else might work with this candidacy group that we've identified that we want to work with or focus on for the moment? What are the current services that exist that might complement or interfere with a program that we're in the process of selecting? What is the role and function of that program? Are the people that deliver that program included in a group of stakeholders? So for example, I think every child welfare agency in the country and every provider has some version of an intensive case management program or maybe a wraparound program. But how do those kinds of programs interact with the evidence-based models that we're introducing? Many of you may know the list very well, and you may know that one of the well-supported programs is motivational interviewing, which is really not a standalone intervention, of course, but is an adjunct to or an introduction to other evidence-based programs. And so there again, you have to think about how do these services interact with each other and how do they complement one another. Next slide. I don't recall who I'm passing this off to.
You're passing it over to me.
Dr. Ross.
Awesome. How are we doing on time? Okay, we got a little bit of time. Obviously, funding is a primary consideration, and it's often what drives pursuit of major funding sources like FFPSA. I think the key point that I'd like to emphasize in a condensed time frame here is examining how the funds or what funds will support the installation of the program or service. And by that, I mean, what will it cost if we need to bring in someone who's going to provide training? And that training usually should be provided first to the managers and to the supervisors then to the select staff that are going to be delivering the service model. What's the cost of that and what time frame? How much time will it take to adjust our data systems so that we can monitor, perhaps through case data forms, perhaps through videotape review, whether or not our staff are feeling competent, confident, and able to deliver this new model effectively and ideally with fidelity. Thinking that through in advance is very important. It helps avoid that primary error of train and hope that we've talked about earlier today. I'm a little hesitant to speak about the other 2 bullet points because our participants here are from all over the country, and it's going to be different in Florida than it is in Texas, than it is in California, or with specific cities. And I think it may be very helpful to engage an organization like the Consortium to actually think through some of these. What's the long-term funding plan like? What's the installation funding plan like? And come up with some creative ways that concerns about funding can be addressed. You can, for instance, next slide, plan on a transformation zone, or it's often called a pilot zone. This is where you take a certain portion of your service system or certain area of service in your organization, and you plan to bring online the new practice model with a limited number of staff, working within the new formats and practices for training, for coaching, for monitoring fidelity and quality of service, and engage a limited number of clients. And the reason we do that, or suggest doing that, is it gives you a safe space to work it out. There's bound to be things that were not considered. You're going to run into quote unquote resistance from staff, and you've got to work with that in a way that doesn't place the onus on the staff, but uses it as a frame of reference to consider, okay, what does this tell us about how we've gone about installing and initially trying this implementation? And then you can take lessons learned from that and make adjustments that are much easier to do on a small scale in a limited portion of your service area before you scale up across the entire organization. And again, an organization like the Consortium or others can help you think through how this can be done in the most effective and efficient manner. How much time do we have left? A little bit, good, 15 minutes. Next slide. Can I pull something up, Jennifer? Can I share screen? I'd like to show something. Let me try it and see if it happens.
Go ahead, it should allow you.
Okay. We flipped through this fairly quickly. So you should be seeing now the tip sheet. Yes? 5 apples? Everybody? Somebody?
Yep.
Yes.
So this is the little tip sheet that we've developed over the course of the last year or so. And the very first thing we start out with, and I know we've said this in passing, but I want to emphasize it, this is best done by selection of a practice is best done by a team of community stakeholders, not trying to make the decisions solely within your organization. Engaging those who will actually be receiving the service, perhaps. Engaging organizations that may also serve the candidacy group or target population that you think you want to serve. Because this will help you find gaps. It will better inform the process of answering these questions. And just to give you a look, this is again going to be available on the Consortium website, and I'm slowly scrolling up so you get a chance to read some of the questions. We've touched on these in the last half hour or so. You'll see that we actually adopted this from work that Jackie did with the Families Foundation. But this is going to be available on the consortium website by the end of this week. We'll have it up and online in a separate page. And we'll also send information about that, as well as the invitation to register for 2 weeks from today, when we will do the second part of this webinar series. And I'll go back to the other slides, if you can put them back up. Trip. Bingo. So 2 weeks from today, October 5th, we're going to show how you use that tip sheet to then use another, next slide please, tool. And this is just the very top portion of the tool, to gather that information as you get answers to the questions on the tip sheet. And then you can make decisions about, does it have to be this way? What's the data that we're missing? Can this be adapted if we don't think it's a good fit for some reason? And it literally prompts you through looking at staffing expectations, outcomes that you're desiring, population knowledge in terms of current outcomes, coaching and supervision formats and the frequency that might be necessary for this new practice model that you're considering. And this will help you, we believe, make more informed choices, more planful, more systematic approaches to making selections of service models before you pursue and secure the funding and then start spending the money. I think there's one more slide, yes? There you go. So we will be sending to you the invitation to the October 5th second webinar, where we're going to show how to actually use the tip sheet with the planning tool. We'll have a couple of examples. I'm hoping that it can be more interactive. We do have some time for some interaction today, but I'd like to make it a little more interactive. We're also offering to a couple of organizations that want to try this out, offering our time without charge, just to get the ball rolling. And in that process, we will also learn from you. All of this will be on our website, ebpconsortium.com. And you'll be getting email blast from us at ebpconsortium@gmail.com. So I think that ends what we wanted to cover, and I think that gives us room for a bit of conversation with participants, if possible. I know someone had their hand raised. I don't see that now.
Yeah, I followed up and did not hear back from them.
Okay.
So I think we could maybe touch on the question that I know came in just to the panelists. I don't know if Rosalind or Dan, if you want to kind of recap the question about EBPs and, you know, the fact that there's different criteria across different, across the different clearinghouses, et cetera.
Well, Jennifer, you're certainly the national expert on that.
I'd be happy to jump in. And we had an attendee who asked about, you know, that there are many different practices that you know, have different levels of evidence, and I think it's important that we're clear that across there is no one definition of what an evidence-based practice is. And I believe maybe it was Dan or Rosalind talked about that at the beginning, but that in the FFPSA legislation, there's very specific criteria. So just because a practice may not meet that criteria doesn't mean it's not an effective practice. It just doesn't meet the specific criteria of that clearinghouse. Being from the CEBC, it's clear that our criteria are slightly different. So there is definitely, I think, unfortunately, you know, differences across the clearinghouses in the rating criteria that do lead to some confusion.
Yeah, and for those who are, you know, interested in that sort of thing, certainly if you go to the preventionservices.appsites.com link that we shared earlier, there is a section on the review process. And it's a very detailed description of all of the different layers and parts of the process. Get your nerd on and go check that out if you're interested in the process. How they weighted the integrity of random assignment, for example, and so on and so forth. That's true. So I know there's also kind of I don't want to say backdoor, but there is a process for folks to working with their states to, if there is a program that is a local program that seems to be very powerful and very effective for a certain group, and there's a commitment to try to study it further and propose that it be added to the list, there is a process for that. I believe there's also information, I can't point to the place, but I believe there's also some resources about that on the Clearinghouse website.
Yes, it is the open submission period, or their equivalent for the FFPSA Clearinghouse. So you can go on their website and make recommendations of programs that you would like to see them rate and review. I know that is one strong way that they decide which programs end up in their, in their pool of programs for review, since there's obviously a limited number and there are many, many programs. So if you're using something or want to see it rated, this is the time to go on and request it on their website. We had a couple of questions come through. One is for the CEBC, asking whether we'll be changing any of our criteria in response, typically I would assume, to the FFPSA criteria. At this point, we're not looking at changing anything. We may make some refinements. We are in discussion always with the folks at APT who run the FFPSA clearinghouse, as well as the other clearinghouses, and we're trying to kind of all bring our rating and our criteria a little bit more in line, so that we can reduce some of this confusion, and then also try to be very very transparent when there are differences about what led to those differences. So you may see some additional information. We'll be updating our CEBC resource that compares the CEBC with the FFPSA criteria in the next couple of weeks. And then we also had a suggestion from an attendee that the next webinar could actually be done as a Zoom meeting, which would allow for more interaction. So we can think about that internally with our group and see if that makes sense for us.
A third one just came in the
Yep.
Q&A. Yeah.
Thank you. Just saw that. So yeah, so someone asked, currently some ratings between the CEBC and the Family First Prevention Services Clearinghouse are different. They vary. And is that we're talking about aligning. Yeah, I think we won't be able to completely align them. The rating criteria themselves are different between the CEBC and the Family First Prevention Services Clearinghouse. So there is not an intention to simply adopt the FFPSA criteria, not at this time. But we want to make sure we're very clear on how the ratings, why the ratings are different, and use some of the same requirements. So where we can, to bring them into alignment. But I think at this point, we're not just going to whole cloth adopt the Family First rating criteria. Okay, other questions coming in?
How many people were here today? I think a little over 100 at first.
Yep. Yeah, so it's possible we could do the next one as a meeting. We have that capacity to do a meeting that large, so we can discuss that.
And the meetings are much easier to be inclusive and interactive.
Yes.
Yeah. I'd like to work towards that.
Yeah, we could set up breakout rooms and that kind of thing.
All right, we've got a couple minutes. Any other questions? Okay, I don't see any hands up, so I think we're good. Any final comments from any of the presenters?
Just keep in mind that these tools, although we developed them because of FFPSA, it's based in sound implementation science and can be applied for any organization, any state system that's trying to think through what's the best way of serving a particular population.
And I'd just like to add on to that, Rosalind, that implementation science, I think people get a bit anxious that it's a whole other set of things that you have to apply on top. one of the values of looking at these tip sheets and tools is in the practice that the members of the consortium have had, it's very much working on the ground and knowing that things need to be practical, they need to be usable, they need to be iterative, so that they're not complicated to use, and they actually enhance your ability as service providers or decision makers to choose what you need to do, to choose what actions you need to take. So they're built very much in the spirit of practicality and using the science and making it very usable on the ground.
Amen.
Yep.
Thank you.
Exactly.
All right, we're just at the end of our hour, so I'd like to thank everyone for joining us today. As we said at the beginning, as this session has been recorded, you will receive a follow-up email with a link to the recording and the PowerPoint slides from the webinar in the next few days. It looks like we didn't update the name of the webinar, as Rosalind was talking about. We'll be doing a webinar in 2 weeks. You will all get an invitation to that as well, so that we can continue working with this and do a little bit more interactive hands-on work with the tool. And then you should be receiving a brief survey about the webinar. Give us your input, and you can download a certificate of attendance after you complete that survey. And as always, the CEBC, here's our contact information as well. And once again, thank you for joining us, and thank you to the presenters.
Thank you.
Thanks, everyone.
Thank you, everyone.
Take care.